Hello, this is Dr. Eric Dillard with HealthStar Physicians for your HealthStar update. Today we have Dr. Michael Dillard, who is an ear, nose, and throat specialist with HealthStar, that's going to talk about the different symptoms between COVID-19 and allergies.
Good afternoon. This is Dr. Mike Dillard from the Providence Clinic. Certainly some trying times that we're living through right now. Dr. Jeff Adams, Mrs. Olson, Mrs. Sharp, here at the Providence Clinic, we have a very busy allergy practice. And with the times with the COVID-19 pandemic, many questions are arising and some of the symptoms that we're dealing with. I want to take just a few minutes today and discuss some of those aspects as it relates to allergy problems here in East Tennessee. As many of you know, just about each of us have some degree of an allergy problem. For several people, that's many different things that causes those problems. It's an environmental issue. We always have the thoughts about the pollen's going to come out around Groundhog Day or when the flowers start to bloom and the trees start to bloom a bit, and that certainly causes a lot of symptoms. I'll start with the allergy aspect of it and then progress along through the virus that we're dealing with. Many allergy problems are coming about because of a stimulant. As I mentioned, it is typically an environmental thing this time of year. Certainly you can have allergy problems throughout the year. Your indoor pet, indoor allergies, dust and mold, that for many of us is 12 months out of the year. But still, there's a significant number of us that have problems primarily beginning in the spring. The usual symptoms that you will see are nasal. There are nasal stuffiness, there are drainage, there are mucus production. You may have headaches. If it progresses for a long period of time, it may lead to infections. But there's the typical stuffy nose and the symptom of drainage going down the back of your throat. Many of us will sneeze, and that's the predominant symptom with an allergy issue. The body is trying to rid the nasal mucosa of the pollen or the stimulant and what that trigger is, and thus it forces a sneeze, which is actually a protective reflex. That's very common for allergy issues. Some of us may cough. If there's drainage going down the back of your throat, you typically will have a cough if it's an allergy problem. You rarely will have a fever. So that's something that really differentiates that an allergy issue versus the virus, and I'll get into that a little bit more later. You may progress to an infection, and then of course that may be associated with a fever. Many people don't usually have lung issues. You typically won't say that you have a breathing issue as it relates to lung capacity. Certainly those with pre-existing conditions, those with emphysema, what's called COPD, chronic bronchitis, asthma symptoms, that certainly can be worsened and that cough may be exaggerated a bit. Also with allergies, it's almost always what we would call wet. Because of that mucus production, there is usually drainage in your nose going down the back of your throat versus the dry cough that we see with some other things. The COVID virus can be devastating in certain populations. You will hear now as there's more and more research coming about and more information becoming more known. The virus is typically a coronavirus that is much like the coronaviruses of old when we would think about a bad cold. The term coronavirus, of course, is a generic term. This current virus is way more than the old coronavirus that we used to speak of as far as just a bad cold goes. The hallmarks, number one, are a fever. It is rare that anyone's being diagnosed with the COVID-19 virus if they do not have a fever over 100 degrees. As I mentioned, that's typically a little bit different than you would have from your typical allergy flare-up. Number two is a cough. And the cough with the virus that's currently going around is almost always a dry cough. It is rarely associated with an abundance of mucus or a lot of nasal secretions. Number three is that difficulty breathing. And therein lies the problem. For many of us elderly folks or those of us that have underlying conditions, especially if we have an underlying lung problem, diabetes are always a significant issue to deal with. We're going to have more of an exaggeration of that response. Also, with going back to allergies, many times you can base this on your history. Most of us know that during the springtime when we first begin to cut our lawn, when we trim the bushes, when we set out some flowers, when we place our mulch around our home, we're going to have those symptoms. And you have several years of history for that. So you kind of know and you kind of can tell because you've had issues in the past and you can sort of compare. That's decidedly different, as I've mentioned, along with the viral symptoms that we're dealing with now with COVID. Many of us just have a bad cold. That is typically a nasal issue as well. Some of us will have a cough with a bad cold. You rarely do not have a fever. So of the one thing that differentiates the typical symptoms that we see here in East Tennessee versus the current COVID virus, number one would be the fever. Almost always you will basically have an unexplained fever. With the flu, you may have fever as well. You may have a headache. You may have body aches. And the COVID virus and the flu have very many of the same symptoms. The flu, of course, typically dies out around this time of year. Those of us that have the vaccine, typically you won't have flu symptoms quite as much. But the fever, the cough, which is dry characteristically, and then the shortness of breath and the breathing problems, really the main elements as far as the COVID virus is concerned. We're happy to help here at the Providence Clinic. I speak for Dr. Adams as well as our nurse practitioners, Miss Olson and Miss Sharp. We're happy to help any questions you may have, and we'll certainly provide any benefit we can. Thank you very much. Good luck and be safe.